Good afternoon, everybody. Welcome to our Act Drug Free Facebook. Hello, wherever you are. I hope you're having a fantastic Friday. So, I wanted to get on here and talk about a couple things. At this point, no one's really a stranger to the fact that we have a drug problem in the United States, and especially that we have an opioid crisis that's been going on for quite some time. And so I felt it was important to come on here and talk about a few things. First, I want to talk about the importance of having discussions regarding drug use, having discussions regarding addiction, being able to have that open dialogue in order to destigmatize some of the issues surrounding these, instances of misuse. I also want to talk about a lot of times when somebody has an opioid overdose, they're usually with somebody, and that person usually freaks out and they'll probably run off in order to avoid any legal repercussions. Now, it's important to note, and I will talk about this a little bit more throughout this presentation, that if you are to run off, you will face legal repercussions. However, if you're with a person who's overdosing and you call 911 in order to ensure that that person is safe, there are laws in place that protect you from legal repercussions, even if you are using or are in possession yourself. So we'll talk about that more. That's called the Good Samaritan Law. But we can go ahead and get started and have this discussion. So this week, from March 21st to 27th, Sunday, is National Drug and Alcohol Facts Week. And this was started by the National Institute on Drug Abuse in order to inspire conversations about drug use and addiction. And so it involves scientists, educators, healthcare providers, community partners, and especially you guys, the youth, or the future of our society. And everyone kind of comes together working towards advancing the science and research that surrounds drug use in order to help us improve our prevention and treatment methods and to raise awareness of the damages that substance misuse can cause. Because substance misuse, starts off with not really understanding what the drug is that the person is taking, or not really understanding the consequences of it. And misusing substances will almost always lead to a dependency or an addiction. So if we're able to have these conversations, that raises awareness, and hopefully more of you would make a good decision towards protecting your health and avoiding misusing substances in the first place. So in 2010, the National Institute on Drug Abuse, or NIDA, launched this initiative in order to promote educational events and conversations to show teens what science so far has taught us about the effects of drug use and addiction. And in 2016, the National Institute on Alcohol Abuse and Alcoholism became a partner with NIDA in this, working together to lead organizations, media outlets, and other government agencies towards spreading the word about National Drug and Alcohol Facts Week, and being able to destigmatize some of these issues. And so, what is addiction, really? So when we think about drugs, we're mainly talking about things like cocaine, heroin, Molly, and alcohol, but we're also talking about prescription drugs, and in most cases, cannabis. And what I mean by that is cannabis with higher levels of THC than they're supposed to have. All of these cause they cause physical changes to your brain and to your body. And these changes make it really difficult to control how much of that drug you use and how often you use it. And then your body starts to adapt to this substance in your system, and you end up feeling like you need more of that drug, or you need a stronger drug just to feel normal. This adaptation is also going to make it really difficult for your body to be able to regulate itself. And once it gets to this point, it can be pretty unpleasant or even dangerous to try to stop or reduce this substance without external help. And what's going to happen is you're going to experience something called withdrawal symptoms. Now, there's two coins to the withdrawal symptoms. There's the physical side of it and the psychological side. The physical discomfort comes from the physical effect that drugs have on our body. And mainly our heart, our digestive system, and our muscles are kind of experiencing the wrath of this. And so you'll experience a lot of nausea, diarrhea, and even vomiting. You'll experience some muscle and bone pain. Heart palpitations and rapid heartbeat will cause things like chills, shaking, high temperature and excessive sweating, and restlessness, as well as exhaustion. So imagine being very tired and not being able to sleep because your body won't stay still. And in some cases, and this is especially true for alcoholism, headaches, or in severe cases, seizures can occur if you try to withdraw right away, which is why it's important to go to a treatment center for drugs like heroin or alcohol. So that's the physical symptoms. That's uncomfortable enough, but then you have to take into account the psychological symptoms of it too. Now, usually some people will start using substances as a way to self-medicate. Maybe they're dealing with some depression or anxiety or some post-traumatic stress disorder, and a friend of a friend, gave them the bright idea of using drugs to numb those feelings. Now, it's important to note that if you try to self-medicate and it works for the first few days, these psychological symptoms aren't really going anywhere. And in fact, they won't go anywhere unless they're properly addressed, talked about, and unless you're able to process them. And so any method of numbing these symptoms, numbing that depression or anxiety or PTSD, is going to backfire. It's almost like putting a Band-Aid over a tumor. That tumor is going to keep growing regardless how many Band-Aids you try to put over it. And the only way to get rid of that is to go to a medical professional or somebody who's licensed to take care of issues like that. So in this case, a drug or alcohol counselor would kind of be like the surgeon removing the tumor from your body. So depression, anxiety, paranoia, confusion, panic attacks, insomnia, irritability, probably from the insomnia, difficulty focusing, intense cravings, and short-term memory loss are very common withdrawal symptoms for almost every drug that you can think of. And so really it's important to keep this in mind, that going to a substance use counselor or drug and alcohol counselor is going to help you deal with these withdrawal symptoms. You're still going to experience them, but you'll have a professional who can guide you through how to deal with them without it becoming too extreme to the point where you have, seizures or any kind of adverse effect to withdrawal. So about 70,000 people die annually from addiction, and that number has been rising exponentially, and COVID kind of did a wallop on that number, and I believe the figure was around anywhere from 78 to 80,000 people who died 2020 and 2021 due to the pandemic and due to people, having to self-isolate. What addiction does is it hijacks the person's brain and body. And so it's generally taking over that personhood, that person's being, and making them center their entire existence around scoring the drug and using the drug. And so when they try to get clean, they're going to be dealing with these uncomfortable physical and psychological withdrawal symptoms. Not to mention, if they try to reach out for help, they're mostly going to be met with judgment and criticism because there's still a lack of awareness and understanding about addiction, and there are decades of stigma towards addiction that, we haven't as a society been completely able to dismantle yet. So as a result, someone who's struggling with addiction is going to feel ashamed for what they're going through, and they'll hopelessly throw their hands up and just not even reach out for help. And so this means most people struggling with addiction would rather succumb to their illness and let their addiction basically kill them versus facing the social ostracization that's going to come with being labeled an addict. So this is really why it's really important to talk about drug education and awareness, to raise awareness about it. This is why it's very important, because this is going to help us remove a huge obstacle for those who are struggling with addiction. So being able to have these discussions about addiction and substance misuse, it brings us closer to finally destigmatizing addiction, at least to the point of getting rid of those barriers that are preventing people from seeking substance abuse treatment or reaching out for help. And so what can you do to help? As I've kind of repeated over and over in this presentation, education is going to be the biggest part of this. So being able to talk to your friends, your family members, and your peers about the risks of drug and alcohol abuse or misuse, and the pain that it can cause the person who's addicted and their loved ones. As an individual, it's important that you learn, practice, and teach healthier coping skills and better understanding. There are countless healthy ways to cope with things like depression or anxiety or any kind of psychological pain. There are medical professionals who can help you deal with physical pain. And it's important that we learn these methods and that we practice them, kind of leading by example, because others see us practicing healthier coping skills and then they want to do the same healthier coping skills versus something that would be unhealthy, like substance misuse or risk taking. Always be willing to listen and learn new things. And so active listening means paying attention to what the person is saying, not just hearing what they're saying, and be open to learning new things. A lot of things that we talk about involving drug use and addiction are going to be outside of what you probably already know. And that's a good thing. It's always good to have that benefit of a different worldview so that you gain a better understanding of the world in general. And lastly, it's important that you be compassionate towards anyone who's struggling with addiction, but also to know your limit. Like we talked about, addiction is hijacking the person's brain. And so in some cases, they will try to score the drug by any means necessary. Even in extreme cases, taking money or selling items that don't belong to them in order to get money to buy that drug. And so, of course, be compassionate, be understanding, but also know your limits. If you know the person who is struggling, you kind of know what they're about. And so it's important to keep that in mind as well. Now, it is possible to save a person's life. When we talk about opioids, for example, there's around 68% of the 70,000 annual overdose deaths that are involving opioids. And I think around 28% of that 68% are fentanyl related deaths because of how potent fentanyl is. And in fact, it's around 500 times more potent than morphine. So really think about that figure for a second, how small of an amount of fentanyl it would take to cause an overdose. But thankfully, during an opioid overdose, anybody can save a person's life. There's this drug called naloxone hydrochloride, and it usually comes in a nasal spray or in some cases an injection. And this is going to quickly reverse the effects of an opioid overdose. It's an opioid antagonist, which means it reverses its effects and it gives the person another chance at life. Now, please keep in mind, naloxone is a temporary fix, and the effects of it aren't going to last very long. And so you must call 911 prior to administering naloxone. That way medical help can arrive and take over before the anti-opioid or the opioid antagonistic effects wear off. But what if I get in trouble? There's going to be police and medical people there. Well, thankfully in most states, you will not be arrested if you report a drug overdose to 911. Including if you're in possession or high on drugs yourself. This is called the Good Samaritan Law. And the reason this was put into place is because the highest priority is not to get you arrested for using drugs. The highest priority is to get that person who's overdosing the help that they need immediately. Because it's a very short amount of time that you can save that person. And so if you're ever with a person who happens to overdose, try to keep calm, call 911. If you happen to have a Narcan kit nearby, which you can get at any participating pharmacy over the counter, and so you don't need a prescription for it, if you have Narcan nearby, that is going to save that person's life, at least until medical help arrives. And so how do you use Narcan? Well, this short video is going to demonstrate.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So, you've called 911 and grabbed your naloxone. Now what?
And I'll leave a link for this video in the description.
This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal with the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
Very simple, straight to the point. Now, it's important to keep in mind, most of the times if somebody overdoses, they're going to be laying down on the ground. And that's fine as well, as long as you're able to get that applicator into their nose, get that first spray in, and then if for whatever reason that doesn't work, maybe they had too much, you can take another spray and spray it into the other nostril. And hopefully by this time, anywhere between 3 to 7 minutes, medical help should arrive and should be able to take over. Now, you can purchase this at most pharmacies. You don't need a prescription, and most Narcan kits are going to come with clear instructions on the box. Now, as I said before, it's really important that you call 911 prior to administering Narcan. If the person needs CPR, the 911 dispatcher is going to help you walk through those steps. It's really important also that you stay on the phone with 911 until medical help arrives. So remember that Good Samaritan law. You will not get in trouble for reporting an overdose. Always be willing to learn and discuss new things like addiction and drug abuse with your friends, your family, and your peers. These conversations are going to help us destigmatize addiction and make it easier for those who are struggling to reach out for help. If you would like to share National Drug and Alcohol Facts Week on your social media, that's going to help us raise awareness as well. That would be a really helpful initiative that you can take. So lastly, we have our resources for substance abuse and mental health treatment. SAMHSA, our Substance Abuse and Mental Health Services Administration. We have the Detroit Wayne Integrated Health Network, and we have a 24/7 free teen crisis text line for those who don't really feel comfortable talking on the phone. And if none of these resources do it for you, you can always reach out to us at Leaders Advancing and Helping Communities. Phone numbers 888-315-5242, or you can shoot us an email at info@lahc.org. Always remember that you don't have to struggle alone. And if you or a loved one are struggling with addiction or mental illness, please do not hesitate to reach out. And please know that we are all with you and we all support you in your attempt to get clean and your attempt to get healed. That is all I have for you guys today. So I hope you have a fantastic weekend, and I will see you next time. Take care.